Good morning, everyone. It's beginning to feel like a summer sizzler out there. This morning, I looked out from our deck and saw my first newborn fawn, white dots and all. It's beginning to look a lot like summer in the hills. I'm Ed Bartling, your external wholesaler, and today I first want to say thank you for your business, and thank you for investing your time with us today. With the help of John Hancock's Vice President, Matthew Fitzpatrick, we will look at a smarter way to protect wealth and maintain health for your clients. A couple items. Everyone is on mute, and we will have time for a Q&A at the end. So please use the area to put your questions. The drawing for the $50 gift card will be done at the end of the webinar, and you do have to be present to win. And don't forget, as we slide into summer, we still have our ongoing summer giveaway. One lucky winner will choose a 48-quart Cordova cooler or a 42-inch gas fire pit table. And 4 runners-up will receive a $50 gift card. Now, this live drawing will be July the 14th at 10:30 Central Time. So mark your calendar. And the qualification runs to July 8th. So you still have time to get those tickets in. In today's world, safeguarding loved ones and staying healthy is a top priority. And a John Hancock with Vitality policy can provide your client with a one-of-a-kind insurance protection that can help your clients do both. John Hancock with Vitality is delivering on their promise to your client, the promise to help members live longer and healthier lives. John Hancock with Vitality is a life insurance solution that offers financial protection, savings of the cost of a coverage, and rewards by making healthy choices. Now, members aren't the only ones who benefit from Vitality. You can grow your business with happier clients and more closed cases. Vitality Plus clients have a 92% satisfaction rate with their agent. Matthew Fitzpatrick is the Regional Vice President for John Hancock Insurance. Matthew shared with me the following. Ed, I believe that life insurance in some form is an essential part to most every client's financial plan, though it is often misunderstood and perceived as overly complex. I enjoy being able to translate a complex product for complex scenarios into understandable explanations to ultimately help agents help their clients achieve their financial goals. I very much enjoy connecting all the pieces of a sale, from establishing an initial need, outlining a particular solution, explaining why insurance might be an ideal asset to bring that solution all the way through. From application and process logistics to product mechanics, underwriting, and closing, being able to connect those dots and see a larger picture helps make each step feel impactful and rewarding. Folks, that sounds like a person I want to listen to. So without further ado, I would like to introduce Matthew Fitzpatrick, Regional Vice President for John Hancock. Matthew, welcome.
Thank you so much, Ed, and thank you everyone for joining today. Excited to be here as always. So as Ed said, the title of the content today is Consumer Perspectives on Insurance, Health, and Wealth. And really what we're going to kind of try to do is connect all the dots between what we've been doing as an industry for so long in providing financial protection to families, and then what John Hancock specifically is doing as a company, and one of many companies within our industry, to bring that even further to also help clients live a longer, healthier life, and really bring together and create a synergy between what really we are finding is on people's minds very much today more than ever. So for our agenda today, I'm first going to just give an overview, a quick overview of the Vitality program, just to make sure we're all on the same page. I know I've been on this platform before and spoken about Vitality. I'm also going to provide some updates of, where we started with the Vitality program, what we've done to improve it, and where we think we're going into the future, both in general terms as well as specifically to address things like COVID. We're going to talk about our own John Hancock Vitality membership base and what we've seen within our own membership data with regards to how they have fared and what they've done within the past 2 years in spite of COVID with regards to their health. And then we're going to spend a lot of time digging into, again, drawing these connections between some of the statistics and data that came out of a third-party reinsurer's own consumer survey and what they found on consumers' perceptions of health and wealth, and draw those connections and show all the similarities of what we found within our own John Hancock Vitality membership base and how the solutions we're providing are really so perfectly aligned to what other third-party platforms and reinsurers are finding they're hearing from their consumers in terms of what they want and what they feel is going to help them propel them and meet their financial and health goals. And then we're going to talk specifically about how Vitality can not only just add to a sale, but it can actually really help drive the sale. It can create a sale that may not have otherwise been there, and it can even save a sale that may not have come to fruition for a number of reasons. So first, I think this really is, in a lot of ways, the real title of the presentation, the crux of it, the right solution at the right time. So again, I mentioned that obviously as an industry, we provide really important protection solutions for our clients, and I know we're all very proud of that. But I think what we're doing even lately goes a step further. And what we've lived through over the past couple of years with COVID has really brought to the forefront and really put people's own health and mortality right in front of them. You couldn't really go a week, I don't think, without reading some type of journal article or newspaper article or blog that talked about how a person's underlying health was going to impact their likely outcome in the face of COVID, right? Things that are largely driven by our own personal decisions and our behaviors. Chronic conditions like diabetes, our weight and BMI, these things really had, and we were reminded of it constantly, a significant role to play in how we were going to fare if we were to catch COVID. And so again, this really brings together this synergy in these two things, right? Again, the right solution at the right time. Not only do we at John Hancock, and of course us as an industry, provide these important financial protections to our clients, but now we're even taking this step further and addressing the other thing that is top of mind, which is their health. So just to recap and as a reminder, the Vitality program is essentially a points-based system. So how it works is a client over the course of a given policy year, they earn points for everyday choices that they take, like walking, getting regular checkups at the doctors, all sorts of things. There's over 22,000 points up for grabs total in the program, and you only need 10,000 to reach the highest status level, which is platinum. So these points goes towards determining what your status level is in a given year, and that status level is going to determine what types of premium savings or cost offset you will likely see in your insurance policy, as well as determine what kind of other rewards and benefits you'll receive from the program. We do have a free version of the program that is automatically included on every John Hancock insurance policy. This is called Vitality Go. This comes at no additional cost, and really what it allows the client to do is take a test drive, right? It allows the client to get access to the entire ecosystem of the Vitality platform and see how they like it. And if they find that they are engaging and they do like it, they do have 2 years or 24 months from policy issue within which to upgrade to our Vitality Plus version. Vitality Plus on permanent policies comes in the form of a rider. It comes for as little as $2 per month. So it's actually quite a negligible cost for all of the upside potential. In fact, as a company, we actually really have no interest in truly charging for it. However, in working with Vitality, which is a third-party company that we partnered with, and they implement this solution onto all sorts of other life insurance platforms and health insurance platforms all around the world, they actually were the ones that sort of advocated for at least putting some even negligible cost onto it, just from the behavioral aspect of it, right? Just so the client knows that they're opting into something, so they're aware of it. And apparently, based on behavioral science, that kind of gives them that sort of recognition and nudge to engage. But what do you get with Vitality Plus? Well, Vitality Plus, like I said, it's kind of the pay to play version. You get all the cost savings from engagement, as well as all these additional benefits. So you can either choose a complimentary Fitbit or Halo to enjoy with membership, to track your activity and get points through the program, or you can opt into our Apple Watch program, which tends to be extremely popular in the choice that most people go with, where you can get your Apple Watch for just $25 upfront plus tax. And through the same activities, the same physical activities that the client would engage with to earn their points and cost savings on their insurance policies, they earn down the cost of that watch over a 24-month period. So they hit certain engagement levels, they can walk away with that watch for just $25 plus the tax that they originally paid up front. There's all sorts of additional rewards and benefits of the program, REI discounts, Hotels.com discounts. And what I like to say about these pieces is these are not meant to be gimmicky giveaways, right? It's not the free toaster oven with the opening of a checking account at the community bank. There is actually, similar to the $2 per month charge, true behavioral science rooted behind this, and the fact that these things that the client earns throughout a given year really help keep a carrot in front of them and keep them motivated to engage. These are just some examples of all the different activities that a client can engage in to earn their points. These are just a few of the many different activities, right? There's preventative health screenings that they can engage in. There's mental wellness, there's education, and then of course exercise. And so again, this might seem like a lot, but what I always like to remind folks is that, again, there is total 22,000 points up for grabs in the program. You only need 7,000 to get to gold, 10,000 to get to platinum, which is our highest achievement level. Typically results in about a 20% give or take cost offset or premium savings. And that may make the program seem complicated because it's like, oh, there's all these different points and activities, but really this is a very individual journey that each client is going to take. I have the Vitality program on myself, and I can tell you that I don't engage in any physical activity points earning. I do happen to go to the gym 5 or 6 days a week, but I don't wear a wearable. It's just not my thing. But I just, go to the gym to take care of myself just because I want to. But I go and get my annual physical once a year. My BMI is in range, my blood pressure is in range, cholesterol, etc. I go get my dental checkup, and then I can complete a few online health surveys. So for a cumulative, I'm going to say between scheduling appointments and actually going to those appointments, I'm going to say 3 to 4 hours within my entire year, I achieve gold, no problem, without doing anything else. So again, there's folks that earn gold status just through physical exercise and no preventative, or there's folks on the other end of the spectrum, only preventative, no physical exercise. So again, it's an individual journey, and it's not like the client's having to go through and engage in each one of these things. They're going to choose what fits their lifestyle best. Every insurance company, John Hancock included, when they underwrite a client, they are looking at them at that snapshot view in time. And for the purposes of pricing them into an insurance pool, they're assuming that they're only getting older and sicker every single week, month, year, right? Because they're underwriting them based on just a snapshot view in time, and they have no other mechanism with which to show otherwise. So people get lumped into a pool, right? You might be preferred non-smoker, but were you the healthiest of the preferred non-smokers, or were you the unhealthiest, right? And there's some average there. Every insurance company, John Hancock included, adds even more buffer into that pricing for chronic conditions like diabetes. And that's because with a condition like that, the client could be controlling their A1C level today, but we have no idea to what extent or if at all they're going to be controlling their A1C level 5 years from now, 10 years from now, et cetera. So there's a lot of additional buffer that an insurance carrier, because they have no other mechanism with which to do so, builds into that price to put that client into that pricing pool. What Vitality allows us to do, and specifically the Aspire portion of Vitality, is we're speaking directly to clients with a chronic condition like diabetes. And we're saying, we don't want to just have you apply for insurance and have you be beholden to a pricing pool at that snapshot view in time because we have no other mechanism. That is what we refer to as static underwriting. We want to also give you the opportunity to engage in dynamic underwriting, right? Show us that you are doing things to take care of yourself, as well as maintaining your condition like someone living with diabetes. And the truth of it is someone living with diabetes is very likely already doing these things to take care of themselves and maintain their health. So why not get the credit for doing so? So Aspire, all you have to do is think of it as an additional aspect of the Vitality platform. It's one and the same as Vitality, but it's just a specific set of things that a client living with diabetes can do to get even more points. And what we see is that because the average client living with diabetes will typically be substandard, right? That's kind of the mechanism by which a carrier will introduce that price buffer. And because of all the additional points that they have up for grabs, we find that this can provide even more cost savings and cost offset to the client, and they can get on average up to 25% insurance premium reduction. And we do provide some additional tools and resources to provide them customized content education to help them with managing their condition, as well as a popular benefit called Unduo, which is sort of a telehealth app with which type 2 diabetics can engage with a clinician and get support there. So one of the things I like best about Vitality, why I feel like it's really the right thing that we're doing and we put so much into it, is that we're constantly making improvements to the program. And so whether you were a client that purchased a policy back in 2015, or whether you're a client that's going to purchase a policy next week, you are going to get the benefit of all these improvements, all these add-ons, and all these enhancements that we've made. We have a real vested interest in making sure that the membership base is committed and engaged in this program, because we want to see our client base live a longer, healthier life. It's the right thing to do, and it also makes financial sense for an insurance carrier to want their clients to have good mortality and improved mortality. So we launched the program back in 2015. We're just past our 7-year anniversary. Since then, we launched the Healthy Food program shortly after that. We said, exercising is great, but I think a trainer friend of mine once said, abs are made in the kitchen, not the gym. So what you put in your body is just as important to what you do physically. And we launched the Healthy Food benefit, giving clients discounts on the food they purchase, as well as points for purchasing that healthy food. We introduced the Apple Watch program, which was a hugely popular benefit and still is to this day. We launched a Healthy Mind aspect to the program, where clients can get complimentary access to an app called Headspace, because we know that in today's world, especially, mental health can be just as important as physical health. We launched the divergence of the Vitality Go versus Vitality Plus. We previously didn't have Vitality Go, but we wanted to give every customer the opportunity to engage and not feel like they had to opt into something. So every policy has Vitality Go free of charge so that the client can give it that test drive. We were finding that so many clients were hitting the top engagement status year after year that we actually needed to create an entirely new reward category. So we started offering complimentary Amazon Prime memberships for clients who engaged and achieved platinum status for 3 years in a row, and we'll provide their complimentary Amazon Prime membership every year after that for every year that they achieve platinum. We had to continue to provide even more carrots because we're having so many people max out on their benefits and their rewards. So we wanted to make sure we're still keeping them motivated. We then, shortly after that, as I mentioned, launched Aspire to specifically speak to people living with chronic conditions, specifically in this case, living with diabetes, because of how we know that they're priced into insurance. And then we just a couple of years ago partnered with Amazon and introduced Amazon Halo as another complimentary fitness device that a client can get through their Vitality membership. I'll take a moment to say here too, it always jumps out at me. We're talking about our strategic partnerships. On this one slide, we've mentioned Apple, we've mentioned Amazon. These are leaders in their own spaces, and I think it speaks to what we're doing and sort of the forward thinking that we're engaging in with how we're making insurance more relevant and enjoyable to own and easy to purchase. And I think it speaks volumes and kind of proof in the pudding, just even seeing kind of the strategic partnerships and companies that we're partnering with to provide these benefits to our client base. And we're continuing to make improvements. Even today, we're adding the latest Amazon Halo device, complimentary, always adding the latest Apple Watch. We introduced new point earning activities. So through the pandemic, we gave clients points for getting their COVID-19 vaccine. We also introduced giving points for pneumonia vaccines, shingle vaccines. We introduced a safe driving point earning opportunity. And again, I'll take a moment to remind, because I know this comes up a lot with safe driving, just even with what the car insurance companies do, nothing with Vitality is punitive. Right? So these are all points you're earning for the purposes of gaining a status and getting premium savings. Nothing about interaction with the program results in negative points or would result in a client being dinged for anything or having their risk class, right? This is all only upside potential and possible improvement. We also took a lot of care and took a lot of consumer feedback and membership feedback about the mobile app. We know that more and more people choose to interact with basically everything in their life through their phones, and that comes through a mobile app. So we refreshed the mobile app and made things a little more clear to the client base. And we saw really good results from that. We saw that physical activity reviews increased by 61%, mammogram submissions increased by 30%, and REI redemptions increased by 112%. Just really making sure that the key aspects and things that we know consumers gravitate most to are really front and center on the app, and that they feel even more comfortable, and it's even more intuitive for them to engage with it. And another quick timeline here, we also, even since 2020, that's where the prior timeline ended that we just looked at, we really made the program malleable through the COVID pandemic. So we knew that a lot of fitness centers were closed, so we gave clients the ability to get points for at-home workouts. All they had to do was really just, take a picture, submit it in of them basically standing in their apartment or their house in their workout clothes, and I mean, that was pretty much it. We didn't want people to be penalized. We really wanted to make sure we were doing the right thing by the membership base. Clients who got discounts through hotels.com, we proactively refunded those nights. We mailed out face coverings to our clients. We automatically awarded them Vitality health check points, knowing that they couldn't go into a Quest Diagnostics clinic or their own primary care physician to get those. We also, like I mentioned earlier, offered points for the COVID vaccination. So just in terms of a consumer experience, I think, again, this speaks volumes to how we demonstrate that we really care and are thinking about our membership base and our clients through something like a global pandemic. If you think about the interaction that most clients would have with their life insurer, it's they apply for it, it's a clumsy process, they have to go through an insurance exam, get poked with a needle, possibly be told that they're just standard or substandard, language that people that don't work in the insurance world not might like to hear, and then after that they get a bill every year. We're really trying to fundamentally change and improve not only the buying experience but the owning experience, and things like this I think go a long way to doing that, and I think contribute to some of the stats we're going to talk about in just a minute. So SCOR and Remark. SCOR is a very large reinsurer, actually one of the largest reinsurers in the world, and they conduct a consumer survey, a very robust consumer survey every year. And I just read the kind of quote that was lifted from their sort of synopsis. Our consumers are educated, knowledgeable, and keen to consider insurance not only to protect from risk, but also for their health and well-being, and they rightly expect more. And so what did this survey find? We're going to go through some of these and draw parallels between what we're offering to address what we also are hearing our consumers want, and they line up very well. Well, the survey showed that 57% of people said the pandemic has made them more proactive about their health. The consumer survey showed that 6 out of 10 indicate that living healthy plays a very large role in their day-to-day life, and that 56% are seeking to be more physically active to increase resilience to illness. I mentioned that earlier about COVID, and every article that we saw about underlying health being an indicator of how you were going to fare with COVID. What do we find within our own Vitality membership base? Well, our own Net Promoter survey says that motivation to live a healthier life is the #1 reason that members rated us a 10. We saw that John Hancock Vitality member engagement increased 20% during the pandemic. A lot of people might think a global pandemic might throw people off. We saw the opposite. We saw increase in engagement. 85% of members who engaged in Vitality in their first year stayed engaged year over year. So once someone just takes the time to get comfortable with the program, it doesn't take much time, they come back and they're very loyal and they continue to engage. The Reconnect survey showed that 64% indicated that health and wellness apps is one of the top 3 ways to improve their health, right? Talking about that engagement and that affinity for wanting to engage with your phone and your mobile app. Nearly 2/3 of people indicated they currently use or are interested in a wearable. And 8 out of 10 indicated that premium discounts were one of the most attractive incentives to helping them and motivating them live a healthier life. So how does this compare to what we found with our own John Hancock Vitality membership base? We found that the John Hancock Vitality mobile app users log in an average of 4 times per day. We found that 7 out of 10 John Hancock Vitality members have linked a fitness device to the program and using other tools. And we also found that 93% of John Hancock Vitality Plus members are realizing financial benefits from their engagement. It's not shown on the screen here, but last I checked, and what that is alluding to is not even only the premium savings, that's actually just speaking to the other benefits like hotel discounts, gift cards, things that you get through engagement levels and checking in at the gym, spin the wheel, get a gift card. Last I checked, that sat at around $15 million that we've paid out over the past 7 years to members just in those periphery benefits, not even taking into account the premium discounts that clients are seeing. We found that there was a 30% increase in 2020 and an additional 33% increase in 2021 on the perceived value of insurance. And that 2 out of 3 who felt that way were looking to increase the coverage. In fact, in 2021, COVID-related events were the #3 reason that led consumers to buy insurance. And that actually even outranked getting married, which is typically a big driver of people getting insurance. Another one being purchasing a house. And 2 out of 3 do look to professionals for advice regarding this insurance. So again, let's just take a moment to sit here and look at this and see the synergy between all of this, right? We have solutions that clients are looking for, and we have tools and resources that they feel they need to improve their health. So they want to live a longer, healthier life, but they also realize that certain things are out of their control and they need financial protection. And most of these folks surveyed are looking for someone like you all on the phone to help guide them through that conversation. So I think that this all, again, the right solution at the right time, this is what brings this all together. We really feel like what we're offering is what clients are saying they're wanting, and it really sits at the intersection of all these needs. We find that we're getting a lot of success even with the actual tangible results of what clients are realizing. So we've reached over 100,000 John Hancock Vitality members in 2021. We find that Vitality Plus cases are 51% more likely to be placed in force. We find that 70% of customers state that the purchase decision was influenced by Vitality. And we are currently sitting at about 2 out of every 3 policies being issued with Vitality Plus. And I actually think that to date into this year, 2022, that's actually ticked up closer to a little above 70%. So it's no wonder then, why this is happening. Clients are seeing real tangible results, and it's because we're giving them the tools that they're saying they want. The last stat that I'll throw out, again, proven outcomes. 80% reporting similar or better health, 47% reporting improvement in blood pressure, 50% BMI reductions, and 33% cholesterol reduction. So again, this isn't just nice talk. These are actual improvements, measurable improvements in the membership that now sits at over 100,000, actually improving their health. And it speaks to why clients are gravitating towards this. And so as someone who sells insurance, how can you kind of bring this conversation to your clients? There's all sorts of different ways to bring up the Vitality conversation. I know a lot of times I'll get pushback that talks about, there's already a lot of moving pieces to the sale. We're doing like a buy sell. We've got to get business valuations, multiple partners we're talking with. It's just, this is one more variable or piece of the puzzle that I just can't bring up. And that's totally fine. We actually find that a lot of folks will just automatically include the Vitality Plus rider on their policy because they know all the benefit it can bring, and it comes at $2 per month. And they might not even mention the program until they drop the policy off to the client, right? They've settled all the other issues. The sale has been made. They're not trying to resell something. It's just, oh, hey, by the way. You also can bring this up post-issue, right? I don't know, I'm sure folks engage in all sorts of different referral habits, but maybe after a sale said and done, client has a moment to breathe, and you follow up with them 2, 3, 4 weeks out and ask how things are going, and maybe you ask for a referral at that point. Or you ask about John Hancock Vitality during periodic reviews, see if they're engaging, or again, remind them and bring their attention to it. Everyone these days has a very short attention span and usually has to be told something 5 to 7 to 10 times to really remember it. One huge benefit that we introduced a few years ago is our Vitality Personal Consultant team. A lot of feedback or concerns for someone initially hearing about the program that I hear are that, well, I know what I'm talking about when it comes to insurance, but this is all very new to me and it sounds great, but it seems like a lot. First of all, again, I would say that as someone selling this, you don't need to know all the ins and outs. It really is a personal journey for the client. You just need to know, I think, the value proposition behind it and the general value proposition. But further to that, we have an entire in-house team of Vitality Personal Consultants. So once a client receives their policy, they can schedule a call ahead of time with our VPC team, and that individual will get on the phone with the client, show them all the, make sure they get registered. If they have any questions on that, show them the main points of the program. And you as the advisor or the agent, you can choose to be on that call, but you don't have to be, right? So this is as little or as much interaction engagement as you want with it. We also, again, as little or as much engagement as you want. You don't have to do anything with the program as the agent, but if you wanted to use the Vitality program as a way to sort of follow up with a client, something different than just checking in, and saying, hey, how's it going? You could say, hey, I noticed that you got to platinum this month for the year. Congratulations, right? It's just a little bit different of a way, I think, to follow up with a client. And this is why we do find that so many policyholders or consumers surveyed say that they're more likely to refer their agent because it just creates a little bit more of a feel-good aspect to the sale, I think. But this is the data that you will receive. You don't have any specifics, and we as a company don't have any specifics on what they're doing. We only get the basic data, and Vitality, has a lot of experience in health and data privacy, and so that's all kept very secure. And so as I kind of just finish up here, again, I'll just say that Vitality really, again, it's not something to be viewed as an extra step or an extra complication to the sale. It's something that really can be an asset to the sale. If you think about it, there really is traditionally only two ways to get money into a life insurance policy, or I should say a permanent or universal life insurance policy. The client either cuts a check, right, pays premium, or they get return, right? They get return from a fixed crediting rate, from variable returns on their sub-accounts or their index segment crediting rates. Those are the only two ways. Vitality acts as a lever onto that policy in a completely new third way to put money into that policy for the client. That's how this works fundamentally behind the scenes. The client's engagement results in them seeing actual dollars put back into the policy for them to see the benefits of however they want, whether that results in premium reduction, increased cash value, increased distributions later for a accumulation sale, what have you. And it's all within the client's control. It's all within their hands. I find a lot of times too that this program saves cases. Client or advisor might have been sure that a client was going to be preferred, super preferred. Something came back in the medical records, client wasn't completely upfront about. Now they have to go back and resell the case. They have, what can they do? Vitality is a way, it's a lever to illustrate on the sales illustration. Hey, we can get this back to the price point that you wanted with the help of this program, something that's in your control. We find too that cases, like I mentioned with Aspire and clients living with diabetes, we find that substandard ratings or rated cases, those result in even more premium savings for the client. And so typically a substandard case will result on average with about a 20 to 25% premium cost offset or premium savings. So again, I think we really do have, as a company, the right solution at the right time for what we've seen, and hopefully we've shown that today. So I'll pause there, show some disclosures, and open it up for any questions.
Well, very good. Thank you, Matthew. Yeah, please use that chat area there, folks, to put your questions in. A couple here came in, Matthew. Say the client is a table B. They're not a diabetic, so they're not in the Aspire program. Can Vitality benefit them even starting out a table B?
Yep. So we make that point about clients living with diabetes because they're so often rated. But yes, even if a client's rated like table B or more for any other reason, you will still see those much more substantial premium savings. Because if you're selling a typical protection policy, the cost of insurance offset, that money that's put into the contract, is actually based on a net amount at risk calculation. So the more you have of COIs, the actual more savings you're going to see from the program. And it's built that way. Yep.
Okay, very good. With the Vitality Go, is the client still eligible for the premium discounts such as the bronze to the platinum?
So not if they're in Vitality Go, but that's why we instituted Vitality Go, so they could give it that test drive. And they have 24 months or 2 years from policy issue within which to upgrade to Vitality Plus. So with Vitality Go, they get access, like I said, to the entire, quote unquote ecosystem of it. They can go on the website, download the app, submit activities, link a fitness device, actually see what kind of points they would earn. And then if they have the points to earn and they want to just upgrade, which they can do very easily through the app as well, then they will get the premium discount. So that's all they have to do. It's very easy. They don't even have to submit a form if they don't want to. They can just do it on the app to upgrade to Vitality Plus. That $2 per month charge will start, but they will then get the premium discounts as a result of their engagement and their points.
Okay, very good. Would you say then the vast majority of the point notifications, if we can call it that, can be done then with this mobile application? Or is there some many forms that a dentist and a doctor has to complete?
Yeah, so I know, for me, you can get all the points you want without ever, we try to make this there are options to submit hard copy forms through fax if you really want to, but really the path of least resistance is the app. So for example, you could easily get to gold status just by linking your fitness device and getting your activity points throughout, right? And that's really set it and forget it. You just link the link the device to the app, and you just automatically feed in your your activity, whether that's steps, whether that's, you know, active calories or check-ins at the gym, whatever it is. And then that's an example of where you're not filling out anything or doing anything.
Okay, very good. Well, indeed, folks, I think we're hearing within that 5-year time frame there of the innovation that John Hancock had this foresight to put in tandem with their policy, and then the benefits that we're seeing, and looking at the future selves down the road, the benefit of the Vitality program. Another bit of innovation that you have there, maybe just very briefly, if you can touch upon, Matthew, is something called Life Track. I see that can be so beneficial, tied in with Vitality. Can you touch on that briefly?
Yeah, absolutely. So Life Track, we kind of think of it as like a GPS for your life insurance policy. It's basically a complimentary, free of charge billing system where as you will get sort of additional or enhanced annual policy statement notifications that will more, I guess, in more detail lay out to you how your policy is performing relative to what you assumed at issue, right? So if you put it on our protection UL or protection SUL, which is just sort of a general account driven, you know, fixed rate or, you know, crediting rate policy, you know, current assumption UL or traditional UL policy. If the crediting rate were to go down, for example, it will, you know, tell them, hey, by the way, this happened and you might want to think about putting more premium into your policy. On the flip side, which actually just happened just back in March, we increased the crediting rate on not only our new policies, but our entire in-force block of business by 30 basis points. So in that case, Life Track billing would tell them, hey, the crediting rate increased. So if you wanted to, you could put less money into it if you wanted to, or you can continue to pay the same thing and just beef up the cash and, you know, put a little more buffer into the policy, however you want to see that happen. So it really kind of acts, like I said, as that GPS for the client, and it's really impactful in conjunction with Vitality because, for example, on our kind of GVUL, you know, guaranteed age 100 VUL single life policy, we can show a client, hey, you know, you start off at X price, guaranteed to age 100, but through Vitality engagement, you can reduce your annual guaranteed premium year by year based on prior year's engagement. And Life Track will be sort of the platform that will tell you that you can reduce your premium to that. It won't force you to do it, but it will tell you that. So it really, yeah, it's a great tool in conjunction with Vitality because it can let the client know, you know, hey, you assumed gold, but you've actually been getting platinum for the past 10 years. You can skip next year's premium. You can reduce your premiums by this much going out. You know, it can help them analyze that in a lot of different ways and really bring forward what the, you know, what the benefit of Vitality is.
Very good, and I like that key phrase that you used, a GPS for your life policy. GPS for your life policy. Another one I wrote down here, Matthew, was abs are built in the kitchen, not in the gym. I wrote that down as a power phrase of mine because in my region here, I'm eating too much fry bread, so I can see why my abs aren't what they should be.
Yeah, that's well, I think a Hollywood actor said that too. That's a classic saying, but yeah, that's a good one. Yep.
Well, indeed, folks, your client right now might be receiving, as Matthew alluded to, like that good driver discount. So why not let them know about John Hancock with Vitality, a healthy lifestyle discount opportunity that you can provide. Again, thank you, Matthew. And I would now like to turn it over to Neil Sperling, our Vice President, who will now conduct the drawing.
Good morning, and thank you, Matthew. Thank you, Ed. One of the things, too, just before I hit the drawing here, is the John Hancock products. Let's take Vitality aside. They're competitive. They're fantastic products. They have a top shelf IUL. They have one of the best fixed current assumption ULs in the business. They have good term rates. So aside from all this is just icing on the cake with the pricing and the performance of their products. So everybody that has been on the call here today is in the hat for the drawing. You must be present to win, so we'll check to see that whomever is drawn is present when they're drawn, and the winner will receive a $50 Amazon gift card. So with that, we'll draw the winner for today. And it is Brian Waits. Let's see if Brian is on the call. Brian has disconnected from the call, so we'll draw a different name. Let's clear the hat. And it is Rhonda Pollock. Rhonda Pollock from North Dakota. Congratulations, she is on the call. And congratulations on winning the $50 Amazon gift card. Thanks again, everyone. I'll turn it back to Ed Bartling.
Well, thank you, Neil. And again, congratulations, Rhonda. And congratulations to everyone. Yes, I mean everyone. The time that you invested today can be so beneficial to your business. All you need to do is to go out and apply a little STP. STP, see the people. And with Vitality, at those life events, you have the opportunity to see the people. And be sure to contact your internal wholesaler for more information and material on John Hancock with Vitality. Until we meet again there July 14th or before, everyone have a good day. Thank you again. Thank you, Matthew.
Thank you. Bye-bye.